This is the Cash Perspective. What's up, good people? It's been a few days since I checked in. But y'all know I had to come back like I left something, because I did. I left the real ones waiting. I got a story for y'all, and the story a little weird, but I want y'all to follow with me all the way through to the end, because I gotta get y'all feedback on this. Let's get to it. All right, so we taking it back to February 19th of 1994. 911 gets a frantic call from this woman's boyfriend. The woman's name is Gloria. 6 months prior, Gloria had been diagnosed with cervical cancer. It was terminal. Crazy part about it, I guess what made it even worse was the fact that she had went to the hospital a couple of years ago. She went there with all the signs, all the symbols of cancer, but the doctors overlooked it. So Gloria had 2 young kids. They said she doted on her babies. And even in the midst of a grim prognosis, she remained optimistic, determined to find a way to survive this situation. So when she was diagnosed, her doctor told her, yo, you got a couple of weeks to wait before you can start undergoing chemo. So she took that time to try to figure out if there was any alternative ways for her to beat this. So on the 19th of February, when Gloria told her boyfriend she was having trouble breathing, he knew out the gate, any type of change in her symptoms, anything that's irregular about her, treat it as an emergency. So he hit 911. Y'all know the routine. Ambulance pulls up, put her on the stretcher, put the oxygen on her face. They speed off to this hospital, a hospital called Riverside Hospital. Riverside is a little town like an hour outside of LA, an hour east of LA. While the ambulance is en route, they call ahead to the hospital. They talk to Dr. Julie Gorchinsky. Julie and her team, this is a trauma center, so they're used to people coming in that's in pretty bad shape. The guy, the EMS driver, he tells her, yo, we got a terminally ill patient here. Heart rate is elevated, having trouble breathing. We need to do something. She might check out. So they're not thinking that they're not going to be able to handle this particular patient. They were wrong. Boom, ambulance pulls up, takes Gloria out, pushes her into the ER. Julie and her team takes over at that point. Gloria's heart rate is through the roof, but her blood pressure below the floor. That's not supposed to be like that. Julie and her team gets to work, right? They administer sedatives, they give her higher levels of oxygen, and everything that they're doing at that moment seems to be working because her heart rate slows down and seems to become even. But that's short-lived. Her heart rate must have plummeted again because they brought the paddles out. They cut her shirt. So now, while they over there preparing the paddles, it's another team of nurses preparing to draw blood. But before that, they noticed 2 things. The first thing was there was a garlicky smell coming from her breath, right? Maybe she didn't get a chance to brush her teeth before, she came to the ER. So they didn't really put too much focus on that. The second thing that they noticed was her skin was oily and greasy. But once again, people don't have time to shower before being rushed to the ER. So, they ignored that. They began to hit her with the paddles, right? Now that they hit her with the paddles, the other team getting ready to draw blood. Soon as they puncture her skin, though, a whole nother smell come up in the room. They even look at each other like, yo, I think I smell ammonia. But the name of the game is to save this woman's life. So they ignore it and they continue working. The nurse completes the blood draw. She then hands the vial to Julie, the doctor. But as the vial was being transferred from her possession to Julie's possession, Julie notices the look in the nurse's eyes. She's spaced out. She's confused. Julie glances down and notices there's little white crystals inside this patient's vial of blood. So while Julie's attention is on this vial of blood with the white crystals in it, the nurse, she done passed from being disoriented and confused to just flat out passed out, like she just collapsed. Another staff member caught her before she hit her head on the floor. So boom, they get her out of there. Back to Gloria, right? But Julia, she's still standing in the middle of the floor with this vial. Like, man, what the fuck? Plus, she looking at these crystals that she a doctor. So she's like, I never seen nothing like this before. But all of a sudden, she starts to get nauseous. And she starts to feel like she about to collapse. So she puts the vial of blood on a tray and she gets up out the trauma room. She goes out there. She sits down. There's another staff member that wasn't in the room, has no idea what's going on in the room. She sees her. She rushes over. And by the time she made it to Julie, Julie was out. Like, Like she was already unresponsive. They get her out of there and rushes her to another hospital. Meanwhile, while all this is going on, all you hearing in that little area is thuds. Bodies hitting the floor, and it's all staff members. And obviously, once the bodies start hitting the floor, the screams are shortly behind it. Then it was the intercom evacuating the hospital. They got the whole hospital out of there. The only people that was left behind was Gloria and a few doctors and staff that was tasked to work on Gloria. So Gloria ended up passing away like 35 minutes after she arrived into the ER. So in that 35-minute time frame, 23 members of the hospital staff had either collapsed or became critically ill. Now, one of those that was most affected was Julie. Like I said, she had been rushed to another hospital shortly after she collapsed. Once she got there, they drew her blood. Guess what they found? Them same tiny white crystals. So now, into the hazmat team. They looking for a chemical leak because that's what makes sense. They comb the entire hospital. They find nothing. They autopsy Gloria. They find nothing toxic in her system. In fact, the only thing that the autopsy had confirmed was that she actually died of natural causes, right? So her cancer made her kidneys and her liver shut down, and that's what she died of. So now, a little time has passed, about a week. Other staff members of the hospital, they began to improve. They began to make progress on their journey to healing. Not Julia, though. Julia is progressively getting worse. She's got pancreatitis. She's got respiratory issues. She also can no longer walk. Her bones are so weak that they can't even support her. So she's wheelchair bound at this point. Of course, Gloria's family is gearing up for lawsuits, rightfully so. So they were insisting that it was toxic fumes that seeped through the hospital that took their loved one up out of here. And it was those fumes that was responsible for what had happened to the staff. Now, 3 times in the previous 3 years leading up to this incident, the hospital had been embroiled in scandal, and they had been held liable for 3 different kinds of leaks. There was the time sewer gas came in from the drain system. Then it was a time when a sterilizer was improperly mixed, causing some toxic gas, and 2 people got sick from that. Oh, and then you can't forget about the time where the hospital's water had been found to have had algae in it. So all around the board, these people were neglectful within this hospital, so it seems. But this time, though, the hospital said, yo, we investigated ourselves and we pinky promised we had nothing to do with this one. So after some time, multiple searches of the hospital, multiple searches of Gloria's home, and they never found anything toxic. They never found anything that could be linked to why this could have happened. So the state of California came out, and they said they knew what happened. They said this was a case of mass sociogenic illness. That's basically when a group of people all think they have the same illness, but there's nothing wrong with any of them. So they essentially said that Julia and the rest of the staff that went through what they went through were pretending, and this was all made up. So of course this pissed Gloria's family off, and of course this pissed Julia and them off. Why? Julia had documented medical ailments that was going on with her. She couldn't even walk at this point, and Gloria's family is saying, yo, our loved one clearly died because of the mishap that happened here. Something happened. No one made this up in their head. But once the state took that position, that only made it more difficult for any type of civil litigation to move forward. But despite all that, they were still gearing up to sue. But before they could actually sue, another firm or another lab was brought in to investigate. This was an obscure firm outside of San Francisco, California. This firm was called the Forensic Science Center. And they did their investigation, and what they found was mind-blowing. So they say their investigation led them to this conclusion. After Gloria found out she had cancer, she began to research alternative ways to beat that monster. One of those alternative ways that she had found was this chemical. This chemical was, in short, DMSO. The proper name for it is way too long for me to be trying to pronounce. Now, initially DMSO was a medicine from like back in the 60s that was sold for anxiety via prescription. But at some point they realized that fucked with your eyes, and they snatched it off the market. But it was still on the market in the form of a gel. This gel was to be used as a commercial grade degreaser. They said that Gloria began to slather this DMSO all over her body as a way to combat her cancer. Now, this is what obviously caused the greasy sheen that the nurses took note of in the trauma room. It was literally grease from this gel that she had rubbed all over herself. Now, the garlic smell came from the mouth because once DMSO is absorbed into the bloodstream, it emits that type of smell. So that's where the garlicky smell came from that the nurses took note of. Okay, cool. That still don't account why all these other people fell out and collapsed. Well, it turns out the night that Gloria was admitted, she also had a urinary tract infection. This urinary tract infection was causing the DMSO to not be able to pass through her system. So the chemicals were just sitting in her body. When the ambulance came through, they put the oxygen mask on her. Boom, another chemical is now being introduced into her body. Oxygen. This oxygen began to interact with the DMSO that was already in her system, and it began to bond and create a new chemical. Now, the next specific thing that had to happen in order to create this incident in the way that it did, according to this forensic center, was the electrical charges. So now this new chemical that is being created from the oxygen and the DMSO might be fairly harmless, but once it was electrified with the electric charges, it became something way more deadly. At that point in time, it became what's known as dimethyl sulfate. Dimethyl sulfate was a nerve gas chemical that they used like back in World War I, World War II, or something like that. It was used for chemical warfare. So basically, when she got the paddles, her body became a can of nerve gas. And then lastly, when the nurses drew the blood, okay, so when this dimethyl sulfate is within the bloodstream, was within Gloria's body, it was unstable, right? And it was fairly harmless because it's harmless at that temperature. But once they withdrew it, and it all of a sudden became room temperature, is much cooler. Now it begins to stabilize. Once it began to stabilize, it made those crystals, it produced those crystals that was in the blood valve, and it became a gas. The staff inhaled the gas, and it proceeded to affect them in the ways that it did. The hospital paid $800,000 to Gloria's family. Julia had some type of appeal in with the hospital. I don't know if it was for her job or if it was for some type of compensation, but she ended up losing to the hospital, and she was a practicing doctor. But this whole ordeal obviously wrecked her body. Not sure if she can even walk again at this point. Crazy. Okay, guys, get in the comments. Let me hear your thoughts. Let me hear if you think the hospital was more liable than what they led on. Let me hear if you think that forensic center, if they theory made sense. It sounded a little bit more rooted in scientific fact, but it was still some things that was left unanswered. Holla at me. Now you want to know.